I will continue. So I really thanks organizers, Agnes Group, for giving me opportunity. Now I will share the next slide. Oral health, I will introduce in very short. So strong and beautiful teeth are the reflections of the smartness and indicator of the good body health. So in fact, in Ayurveda, it has been described as the beautiful teeth as the markers of the good health. Purely white teeth gives very good appearance to the face itself, and the inside of the oral mucosa and all other anatomical landmarks and physiology of the oral mucosa itself plays a very good role in the beauty and in the health itself. So I will describe that in my next slides. Teeth and the body are interdependent regarding the health on each other. Both have the effects on one another. Okay, so good care of the teeth and gums itself can help us to live healthy longer, and that is a good immunal life. Oral health is important in overall health, and it also affects the other functions of the body, say for example digestion and formation of the stools, formation of the other body elements regarding the we consider in Ayurveda as the dhatus, or the that is the building tissues of the body. So the oral health and good teeth can contribute a lot regarding the building of the body regarding our health. So oral bacteria and associated inflammation, so that might play a very significant role in some diseases. So I will discuss further on this topic in next slides. So oral health, all the oral diseases contribute to a major health problem worldwide. So we have to study this significantly. Oral health respects the general well-being, and it relates to our quality of the life. So it relates very closely with our digestive system, because the digestion itself starts from the oral mucosa. So we have saliva there, and the contents of the saliva need to be physiological for our good health and good digestion. So many body tissues like blood, muscles, bones, nervous tissue, as I mentioned, in the building tissues of the body, are dependent on the digestion. Many enzymes and vitamins like vitamin B, C, D are also associated with the oral health. So there is a definite linkage of the oral diseases and the activities of the microbial species that form part of the flora of the oral cavity. Through this discussion, I will try to make some linkage between Ayurveda and modern knowledge. Okay, so there are some interlinking points are there during my slides. So dental caries and periodontal diseases are among the most important global oral health problems. Although other conditions like the oral and pharyngeal carcinomas or the cancers or other oral tissue lesions are also important. So oral health, as we told, is not limited just to oral cavity. So what is my important point? Oral health is limited with our digestion and other body functions also. So oral health respects the general well-being and relates to our quality of life. So it has a relation with digestive function, strength of the body tissues, etc. So I think there is some repetition here. So there is a linkage of oral diseases and the activities of microbial species that form part of the flora of the oral cavity. So oral health contributes to various diseases and conditions that may include some serious conditions like endocarditis, cardiovascular diseases, pneumonia, pregnancy, and some birth complications. So oral health can contribute to these complications also. Certain conditions might affect the oral health, like diabetes. We have seen most of the diabetic patients have dental problems or the gum problems there. Immunocompromised conditions like HIV, osteoporosis, and some elderly diseases like Alzheimer's diseases have more prominent dental problems. poor oral health definitely lowers our body immunity. So conventional modern medicine has only limited success in the prevention of the periodontal disease, not in the treatment, in the prevention of periodontal diseases. And in fact, much less attendance has been given to this point. So prevention is very important regarding our health, and in that treatment, we can contribute a much. So there is a need of alternative prevention and treatment options for oral and dental health problems, so that are safe, effective, and economical to the poor people also. So this needs comes from the rise in disease incidences, specifically in some developing countries. So increased resistance by pathogenic bacteria to currently use antibiotics and some chemotherapeutic agents is a challenging problem to the medical world. So as the bacteria and viruses evolve day by day, so they become resistant to routine antibiotics. So this creates the resistance problem, and bacteria stop responding to routine treatments. Some opportunistic infections, specifically in immunocompromised patients, also create problems. So this can accentuate the rate of the infections and create the conditions more grave. So financial considerations in developing countries regarding the advanced treatment in the dentistry is also a problem. So we have also to think about this. Alternative therapies can offer safe and effective natural treatments. Natural phytochemicals isolated from the plants are used in this traditional medicine, are considered to be good alternative to synthetic chemicals, as these are very less complications, and they are safer and can be easily accepted by human bodies as they are from the natural sources. So several chemical agents are commercially available in the markets, but these can alter oral microflora as well as the large intestinal bacterial flora. So that can cause the that is enzyme difficulties, or that can cause the vitamin disturbances. So we can face other problems like the recurrent stomatitis, indigestion, etc. So we can get some undesirable side effects from these agents, such as vomiting, diarrhea, and in some cases tooth staining also. I will talk about Ayurveda now. Ayurveda is the very ancient system. Say, for example, we can say long ago, 5,000 years back system. So it is a proved system, and in India and subcontinent, it has the holistic approach towards the health. So we don't consider every organ as a different system. So we consider as the one and whole system. That means the holistic. We look the whole body towards the one. Just it is not like that the orthopedician looks to the bone itself, and he doesn't even does the per abdominal examination, or doesn't think about the digestion itself. So Ayurveda doesn't think like this. So Ayurveda states that the bone formation or the digestion is very important. That is a bone health and the digestion. These are the linked parts. So disease treatment involves the use of the safe and natural drugs, diets, and certain practices in Ayurveda. So nowadays Ayurveda is widely practiced in the Indian subcontinent, and in recent years it has attracted so much attention in the economically developed countries like Europe and the USA itself, Japan and Australia, and many other countries in the world. So as per ancient Sushrut Samhita, that is a Brohitree, comes in the Brohitree, or the main textbook of the Ayurveda, surgical test of the Ayurveda, it is called. So health is described as the equilibrium of the three biological humas. That means doshas, we call it as doshas, and the 7 body building tissues, we call it as dhatus, proper digestion, and a state of pleasure or happiness of the soul, senses, and the mind. So balance among these doshas is very important. That is a vata, pitta, kapha is necessary for the health. So together these three doshas govern all the metabolic activities of the body. when their actions in our mind body constitution are unbalanced, we experience psychological and physical wellness, and when they go slightly out of their balance, we may feel uneasy. This is the basic concept of the health and unhealth in Ayurveda. So dosha samya, or the balance of the doshas, is very necessary regarding this. So when they are more obviously unbalanced, symptoms like the more obviously imbalanced, or we can call it as a prakopa, that is out of limit, symptoms of the sickness can be observed and experienced. So as per Ayurvedic basics, dosha dhatu, or the body basic elements concept, everything in the body is made up from ahar, or the food we call it as after the proper digestion. So teeth are considered to be the made from the asti dhatu, as per Ayurveda, that is a bony tissue. Gums and tongue are made from the rakta dhatu, that is the blood and the muscle tissues, or the mouse. So during the first and second trimester of the embryonic life itself, when the body tissues are being formed, all essential factors should be normal, and any internal are being formed, all essential factors should be normal, and any internal or external factor like drug intake, malnutrition may affect the normal body tissue formation. Diet at that time should be healthy to the bones and muscles to take the muscles. For example, it should be associated with the milk and the other related milk products. Asti dhatu kshaya, or the osteoporosis, can adversely affect the health making, or the that is the teeth health in the form of decays. So we call it as osteoporosis here. That means the thinning of the bones. Whereas the vidaha or vikruti, that is inflammatory conditions or the pathological changes like the inflammation and the suppuration in the rakta or the blood and mouse, that is a muscular tissue, adversely affects the gum health, so that their teeth become more prone to decay. So according to Shalya Tantra, that is a surgical text, and the Salakya Tantra, that is a one branch related with the head, that is a ear, nose and throat diseases, there are 65 varieties of the oral diseases are described. So 8 on the lips, 15 on the alveolar margin, 8 in connection with the teeth, 5 on the tongue, 9 on the palate, 17 on the oropharynx, and 3 in the generalized form. So various procedures and treatments such as the oral cleansing, extractions, excisions, flap surgeries, etc. are advised in Ayurveda. So in Ayurveda, the basics like the dinacharya, that is the daily regimen, is very important regarding the oral health. So Ayurveda guides for the proper oral hygiene with the help of simple herbs for the teeth cleaning and mouthwash, gargling, miswak, etc. So Ayurveda guides for the proper intake of the rasas, or the taste we call it as in the food. So use of the sweet, that is a madhura rasa, lavan, that is a salty, and the amla, that is a sour ras, should be minimal. That this should be minimal. So as it forms the inflammation or the bacterial growth as per Ayurveda theories. So consume a sufficient amount of the bitter, that is a tikta, and pungent and astringent taste is important regarding the oral and dental health. So there are approximately 1250 Indian medicinal plants that are used in formulating the beneficial measures according to Ayurvedic literature. So so this is a 5-year-old system of the medicine recommends the treatments with the specific herbs and minerals to cure the various diseases. So botanicals in the Ayurveda materia medica have been proven to be safe, effective through the use of the several thousand years. So as most of the oral diseases are due to the bacterial infection, and it has been well documented that these medicinal plants have significant antibacterial activity against the various microorganisms, including bacteria that are responsible for dental caries. So botanicals in Ayurvedic pharmacology have been proven safe, effective the exploration of the botanicals used in the traditional medicine may lead to development of the novel preventive and therapeutic strategies for the oral health. So herbs taken.
Doctor, conclude, please. You still have 2 minutes.
Yes, ma'am.
Conclude. You still have only 2 minutes.
Only 2 minutes, ma'am. I will finish. I will try to best. So neem bark and the leaf extract is the most effectively used in preventive the cavities and the gum diseases. Mouthwash containing the neem is remedy for the tooth decay, oral infections, and other. Tricks of the neems are used, that is azadirachta in the chewing sticks. Oral rinses are made from this use in the periodontal therapy. Triphala is the again wide spectrum, has the wide spectrum activity against the herbs. So modification processes, main Ayurveda Panchakarma can be very effective in the that is a balance of the body regarding the immunity and the digestive function. So supportive other procedures like the Shirodhara, that is a head oil instillation therapy, Kavala, that is holding the medicines in the mouth, Dantush, that is a gargling, and Tambul Sevan, that is a better lap seven, also contribute a lot in the oral health. So these are the some figures regarding the Panchakarma, that is a Vamana, that is extracting the Kapadosha from the upper oral root, Nasya, that is a use of the medicine through the nostrils, Virechana, that is a purgation treatment, Basti therapy for the Vata dosha through the upper rectal root, and that is a blood-letting treatment. So these are the some figures related with the Panchakarma therapy. So it also recommends some more procedures like the for oral health, that is a Danta Davan, brushing, Jivan Nirlekan, that is tongue scraping, and Gandusha or the gargling. So this is a more description. I will skip this slide. So oil pulling is an therapy that is a inform in Ayurveda, that is a Gandusha. Here oil or the quartz can be used for to treat the to keep the oral health. So in Ayurveda, well-known herb, that is amla, is used, considered as a rebuilder for the oral health. So tissue regeneration concept works here. So regular use of the bilberry and hawthorn berry fruits stabilize the collagen and strengthens the gum tissue. Licorice, the root, promotes the anti-cavity action and reduces plaque formation. I will finish, just 1 or 2 slides have been remained. Herbs such as the cinnamon bark or the turmeric root, alfalfa leaf are taken internally to strengthen the bone tissues. So these are the some Ayurvedic drugs that is including Amla, Dadim, Lavanga, Dativan, Gotukala, and Ghrutukumari. So Guruchi, Jasmine, Kantakari, Nimbu, Mango, Neem, Nilgiri are used in Ayurvedic literature. So orange, Tila, Triphala, Tulsi, or Haridra are the main drugs. So conclusion, I will finish. Oral dental health is very essential for oral health. Ayurveda is a holistic system, so can effectively prevent. Ayurvedic drugs procedures are safe, simple, without any side effects. Ayurveda treatments are helpful in digestion, excretion of the waste, maintains the proper pure condition of the normal functioning of and well-being of the cells and tissue. This is very important. So many Ayurvedic drugs are effective against harmful pathogens causing the most of the oral diseases. So they also show analgesic, anti-inflammatory, astringent, and tissue rebuilding properties. So further researches are necessary for this, so we can draw the proper safe strategies with the help of the Ayurveda. So I thanks the organizers here for giving me chance and some more extra time also. Thank you very much.